Welcome back to ABC-7 at 4. Healthcare workers continue to be pushed to the breaking point as they battle the Delta variant of the coronavirus, many of them trying to save the lives of those who are unvaccinated. ABC-7 medical contributor Dr. Neha Sharma, the medical director of the Hospitals of Providence, Northeast, and Horizon City, joins me now. And Dr. Sharma, there have been recent reports in the media about healthcare workers succumbing to what's called compassion fatigue and moral injury. What exactly do those terms mean?
So, Mark, compassion fatigue is physical, emotional, and psychological impact of helping others. And these are often through stressful and traumatic experiences. It's different from burnout, which is usually a sense of fatigue or dissatisfaction that can add up. And moral injury happens when we commit, bear witness to, or fail to prevent an act that goes against our moral beliefs. In the healthcare context, that moral belief is the oath that we all took when we became healthcare providers. We have to put the needs of our patients first. Now, every time we are forced to make a decision that contradicts our patient's best interest, we feel that moral insult, and usually that insult becomes injury over time.
Now, when you talk about that specifically, is it when you have an ICU full of COVID-19 patients and not enough ventilators to go around?
Exactly. When we don't have enough vents, that is an example, that is delay of care. And also an example would be a cancer patient needing surgery, but elective surgeries are canceled and the surgeon can't perform the surgery because there are no beds. Another delay in care. So that results in moral injury.
Dr. Sharma, what do you think is fueling these feelings?
Medical professionals are exhausted. They're exhausted from the grief and trauma of the pandemic. It's high volumes that we deal with. It's being short-staffed. It's dealing with unvaccinated patients who are misinformed. It's exhausting to try to convince an unvaccinated patient who's extremely sick from COVID that vaccines do work. And it's exhausting to convince the same patient that ivermectin and hydroxychloroquine do not work. This is happening on a daily basis. And it's also navigating the constraints of the healthcare system, the lack of resources and tools that help us do our jobs effectively. And you have to remember that this is a very high liability profession, which is further contributing to the emotional and physical toll.
So what do patients need to know, Dr. Sharma?
They need to know that no matter what, no matter how exhausted we are going to do the best for our patients. We are going to put their interest first. You're going to hear the term compassion fatigue, you're going to hear moral injury, but doesn't matter. Your care is not going to compromise because after all, we all took an oath.
So how can we help healthcare workers?
I think the drivers of compassion fatigue and moral injury, they need to be addressed on a large scale. We need to realize that healthcare providers are humans as well. We need to care about their satisfaction in addition to the patient satisfaction. We need to focus on their mental health, provide them resources. And the long-term solutions are going to have to demand changes in the business framework of healthcare. It's got to be more than promoting mindfulness and resilience. It has to be an environment that values a healthcare provider's time. It prioritizes healing over profit and also focuses on their psychological well-being. And I also want to ask our patients to help us be a partner in your care. Help us with this public health disaster. Trust the science. And if you have questions about the vaccine, please talk to your doctor.
ABC-7 medical contributor Dr. Neha Sharma, as always, thanks for coming on today.
Thank you, Mark.